allowed you to record, and I think I've given you the tick there. You happy with that? And I will record from now. That's good. That is a recording. That's good. Okay, I think that's everybody, good friend.
Right, sir. I have pinned your video. The recording has started.
That's wonderful. I hope everybody can hear me. We're going to kick off. Good evening, Dr. Rupam. We're going to start and talk about hydrotherapy, and that's the topic of the day. First of all, a big thank you for Gufran for initiating the talk and the webinar this evening on hydrotherapy. It is great work with education opportunities in India, and I'm looking forward to the opportunity to coming there and sharing in practical terms details of hydrotherapy. We're going to kick on, and I'm going to call this an introduction to hydrotherapy. It's a theory, and we can talk about the main areas of hydrotherapy. If there's any questions, there'll be plenty of time to get them addressed as well as we proceed. And there's also people have the opportunity to put a chat in as well, and I can respond to any questions on the chat too. We've just got somebody in the wait list now. I just admit it's Priyanka and Sikanda. So I think we might have a full house now, Gufran.
Right, sir. There are 11 people. You can start now. If someone has left, we will send them this recording after this.
Yeah, we've got all the participants. Okay, good evening, Samir. Thank you. We'll kick on. Hydrotherapy. It's essentially it's physiotherapy in water. Now, it's got a number of terms. We can call it aquatic therapy, aquatic physiotherapy. Hydrotherapy is the most common term. It's held by physical therapy in water. There's lots of different terms that you can choose to use. In Australia, physios call it aquatic physically for funding bodies, that they can quickly identify that it's physiotherapy in the aquatic environment. So that's some of the terms and definitions of hydrotherapy. All good? Now, definitions of it, essentially it's hydro, it means water, and therapia, it's a Greek word for therapy. Water therapy, it's a subcategory of physiotherapy. And there's not many therapists or physiotherapists that choose to use it. My job is to persuade and educate physios that hydrotherapy can be a very big part of your business, especially if you're passionate about water and physical therapy for those that can't achieve their goals on land. There's some requirements that's needed, and I will get onto chronic disease, by the way, and that's one of the main areas of tonight's this afternoon's talk. Some requirements you need would be wonderful. Sometimes it's not always practical and possible. So there's other variants you can use. You need a water environment with reasonable temperature and adequate depth. If we're looking at the temperatures for hydrotherapy, anything from around 30 degrees onwards and northwards is perfect. 31 to 3. The ideal would be 32, 3, 34 degrees centigrade. That's perfect. You can get away with 30, 31, but it starts to get a little bit of a shiver effect. Once the temperature is lower than skin temperature, we get a bit of discomfort and shiver, and skin temperatures around 28 to 30. So a common question asked on my courses is, can we do hydrotherapy in 27, 28 degrees water? You can, but it's uncomfortable, it's unpleasant. And if you're looking to relax taut, tense, high-tone muscles, it's not going to work. People are going to contract and rebel. So get the temperature right is a prime ingredient to maximize your participants, your clients or patients, whichever word you choose. That's the temperature side addressed. Depth. And this was a question that was asked along with swimming ability on a teaser last week. Depth of water, you're looking for the adult heights around 1 meter, 1.1 meters. There are great depths to do hydrotherapy in for adult heights that we see in the general population. I've seen pools, hydrotherapy pools, get away with 0.9 and anything up to 1.34. But really, what you're looking for is once it starts getting deeper and deeper, you really need that swimmability. But clients can't actually stand up there. It's above their heights in many cases, especially if you've got short clients. So ideally, a fixed height pool is nice, 1.1, 1.2 meters. We run from 2 pools, one that's 1 meter and one that's 1.2, the fixed height pools. Variable height pools offer you more options, from the minimal height of 0.9 up to 1.4. So you can do a little bit of neck deep walking for those clients that really want touch weight bearing or partial weight bearing, down to the 0.9, those clients that are tall clients, or those clients that can do a little bit more weight bearing wise. So look, we've had a little touch on the definition of hydrotherapy. We've looked at the temperature. We've looked at the depth. We'll have a little look at the access, and there's a few access options. 1, steps, 2, ramp, 3, hoist, waterproof wheelchair down a hoist. If it's kids, you can transfer them from the side of the pool into the therapist's arms if they're little toddlers, 2, 3, 4 years of age. There's a number of access methods. You could just jump in, but we're looking at clients that have conditions and disabilities. So what we ideally want is a pool with safe, reasonable access. A ramp is perfect. Those ambulant clients can walk down a ramp, holding onto a rail. Those clients that can't walk, the wheelchair bound, can be wheeled down a ramp with a waterproof wheelchair. So that's the best options. Once you take a step backwards and you're only looking at step options, stepping down into a pool, you start to lose some of your clients, those that haven't got that step ability, the ones that can't climb up and down steps. So it limits your population. Many therapists do deliver hydrotherapy from swimming pools, which have vertical steps, and some pools which have oblique steps. That's fine, but you're going to get just the healthy type of clients and chronic conditions rather than those more challenged ones that can't manage it. So try and secure a pool with a ramp access if possible. How do we get the access with those more severely disabled clients? Hoist is one option, or we can transfer them into a waterproof wheelchair and wheel them down the ramp. So that's a nice, easy option for the severely disabled and clients that cannot weight bear and transfer into a chair or walk down a ramp. So you look at, it's an important feature is the access and the temperature and the depth. Once you've negotiated those aspects, you're doing fine. We then look at the consistency of the environment that you're working in. We need reasonable chlorinated water, clean water that's safe, that clients aren't going to get infected with. And when we do our formal courses, we talk about the pH and the chlorine levels and all the different parameters that we need for clear and clean, safe water. Essentially, the pool needs to be blue and see-through. If you can see through to the bottom, it's reasonably clear. If it's cloudy, then there's something wrong with the water and it needs testing. So do have in place a formal system of making sure it's safe, clean water that you're operating in. That's the sort of gold standard. But you know, in some countries and some areas, you don't get the ideal. You don't get the ideal pool access, and sometimes you have to, or you can improvise. And I know of some of my therapy colleagues in Vietnam that do hydrotherapy with cerebral palsy clients in the ocean. And they take the kids into the water on the side of the beach, one at a time, and they give some hydrotherapy in that improvised environment. So, you know, I'm conscious, I'm aware that hydrotherapy in a first world country like Australia, with all of the resources and money available in all the councils and governments, you can have the perfect pool. But also there's many countries, third world countries that I visit, that you don't always get those resources, still want to do hydro, so you can improvise, but it's not always the ideal. You can get by to a fashion. So that's the access. We're looking at the depth, the temperature, and the definition. Looking at a little bit how the water affects the body with the physics. And the physics is many things. One is the buoyancy. As soon as we walk into the water, we get that uplift. We get that Archimedes principle that deloads the set. And that's absolutely perfect for those clients that's really struggling in an aquatic environment. We'll just get one more addition there that's just arrived. I'll just wait till Purnima joins us, and she will be joining in any moment. So we're looking there at the buoyancy aspect, and that lifts the body. And depending on the individual's height and the depth of your pool, you'll get anything from 50% at waist deep, 70%. Good evening, Purnima. Anything up to 75, 80% at chest deep water. Great offloads for clients with hip problems, back problems, knee problems. Those clients that really need to ambulate, difficult on land, in water, absolutely perfect. The obese clients, it's really hard when you're lifting 100, 120, 150 kilos around 16 hours a day. Water is a wonderful environment for the morbidly obese population. They can actually exercise where they couldn't in any other environment. And we did some research on hydrotherapy and obesity, and we presented that on the world platform. And we're looking to present that again in April in Dubai at the World Confederation of Physical Therapy. Abstracts being submitted. Now, there's some of the benefits with the buoyant aspect of the physics of the water. We then look at the swelling aspect of clients, those with swollen joints, swollen limbs, lymphedema, intransigent swelling that's just not shifting. The water will do that. We get the compressive effect, the hydrostatic effect, as soon as we're immersed in water. The deeper, the better, and the more hydrostatic pressure we get. And that's based on Pascal's principle, who was a physician in France in the 1800s. So we've got that nice swelling compressive effect on the physics. We've got the buoyancy that acts to deload the body. Specific gravity is another issue that we deal with, and that determines if something floats or sinks. And the body tends to sit around 0.97. Water has a specific gravity of 1. So even if we're in the deep end, stranded, we're usually bobbing above the water just a little bit because of that little bit of advantage we've got on the buoyant feature. Around our body itself, the fat on our body is much more buoyant, and that's at about 0.8. Muscle, it's heavy, and that's about 0.1, and the bone constituent of our body is around 1.5. So the more muscle and boned individual you are, the more likelihood you are to sink, and the more adiposity and fat on your body, the more likelihood you are to float. So that's some of the physics and body percentages that we see. And we use that to our advantage. Some products sink readily, like diving ingots. Now, diving ingots we do use as a dive belt. and that's used for traction on our body. And traction's a wonderful force for pain. We may be, many of us tuning in tonight as physios will have experienced maybe traction on the hospital wards or in the outpatient clinics, where we do some traction to relieve symptoms in the neck or the back. You can do that in the pool. And we do, and I presented a paper on that at Malaysia last year at the Chronic Pain Conference. So that's a nice feature you can consider. For the back traction, we use weight belts. Now that's the advantage of sinkable products like ingots and weight and lead. And lead is very sinkable. Products that float we use to our advantage, like noodles and kickboards. And they are used to keep people afloat or to use as resistive devices. So the specific gravity, it's a reasonably important feature of the physics side of things. Physiology, be aware that one or two things change as we get deeper into the water. Cardiovascularly, renal system, respiratory system. So those are one or two things to be aware of that make a difference to respiratory status and cardiovascular status. If someone's always, if someone starts off in quite a fragile, high-risk state, cardiovascularly or respiratorily, and then you immerse them in a compressive environment like hydrotherapy at neck level for a prolonged period of time, when they've already got reduced vital capacity, it may well just push them over the edge. So be aware with those two particular populations on depth. Not a contraindication, but it's an awareness feature that you don't go too deep with certain populations. And there's quite a nice segue into contraindications when not to take somebody into the water. There's a few things. Clearly, one would be open wounds. Anybody with open wound and you mix it with hydrotherapy, warm water, high risk of rampant infection. So wounds should be healed and sealed. Healed and sealed. Don't risk taking a wound into the pool. It's far too risky. It has happened many times. People think it's fine. Cuts and scrapes, they're superficial. Surgical wounds are deep. So that's the difference. Yes, you can put a Band-Aid or a dressing on a cut or a scrape. That's fine. It's superficial. It's not deep. And that's where you get the infection. So no open wounds. Anything that's particularly unstable. Unstable angina, unstable blood pressure, unstable diabetes. Once they're stable, they're good to go. They're good to go. So they're fine. Epilepsy is often a question asked about the water. And you know what? When we're running our hydrotherapy sessions, and we're due back this week after nearly 3 months of being sidelined with the coronavirus. Thankfully, we're expected back. Restrictions are being lifted. And when our sessions are running, probably 40% of our population have seizure histories. That many. We have a client that comes in, and every single session in the water, he has seizures, and many of them. So whilst many authorities say seizures are a contraindication in the water because it's too dangerous, it all depends on if you've got the training, you're comfortable and experienced with seizures and epilepsy, and you're aware that the client has a history of it. Now, my team of staff, once a year, we do seizure management training. Staff feel much better about the prospect of the different types of seizures, the management of the seizures, the triggers for seizures. We know when they're coming on, we know how to manage them. And we see them every session, and we simply support the client until the seizures run its course, and we're back in business. The session often carries on. So contraindication, if you're inexperienced and not sure, it is. But if you know what you're doing, and you know, if you exclude seizure clients, you're excluding almost all cerebral palsy clients, Down syndrome clients, intellectually impaired clients, brain injured clients. They've all got seizure histories. And they're the populations that really benefit from hydrotherapy. So if you're worried about that topic, my word is within the next 12 months, get a little bit of training and education on seizure management. And you know what? We may be able to get a webinar going as well. And that will be a nice little continuation of today's starter on hydrotherapy. It's an important safety feature. That was a segue on contraindications. There's one or two others as well. If people can't swallow, clearly a water environment, we don't want people to swallow water because they haven't got that reflex, the swallow reflex. So do we keep them out? Well, if you're doing one-on-one with the client and you're aware that they have got peg feeds, they've got the button in their stomach that feeds them and they cannot swallow. We've got 7 or 8 clients with peg feeds that can't swallow. We take them in every session, but we're aware of it and we know how to manage it, and we ensure that they don't ingest any water. There's no underwater work. We do not get their heads underneath the water. So that's a few other things. Now on the formal courses, we go through the contraindications in a lot more detail. They're the main ones. They're the main ones we need to have a consideration of. A few other things. We're looking at duration of the session. Hydrotherapy duration. And you know, it's a common question asked. How long do we keep clients in for? You know, if you kept clients in for 2 hours, you'd never get any other clients in, and you'd never make any rupees. You can't have 2-hour sessions unless clients either can tolerate it and they're happy to pay for it. Clients ask me whenever they've got money for hydrotherapy, how long will the session last? And you know, there's no fixed time that we say. Session on tolerance, and I tell individuals exactly that. How long will it last? Well, it'll depend how long you can tolerate. Now, some clients can tolerate 15 minutes. It's a tough workout. I had a client in the clinic today with inclusion body myositis. It's a subsection of muscular dystrophy. We have hydrotherapy with this client in the past, 15 minutes, and then you build up to 20. Some clients are so deconditioned, they can't manage 45 minutes. So remember, it's tolerance, gradual and progressive, and thereafter onwards and upwards. And we'll get clients up to 25, 30, 35. Some clients go 45, and when clients get more tolerant to the session, we'll say, do you want to upgrade to a double session? Double fee as well. So clients sometimes do 60, 80 minutes in the pool, and that's absolutely fine. It gives us lots of time to do stretches, passive and active ranges of movement, fitness options, and specific strength activities and mobility, balance, coordination, whatever. And some clients make quite a journey to get to the pool. So to kick them out after 15 minutes doesn't quite warrant the journey time that they've had. It's nice if you can get a bit of duration and make it worthwhile. So listen, that's the duration. Looking at the fees. Now, I can only talk about Australia, but you can do similarities to India and Philippines and Thailand and all of the other Asia, South Asian countries. We charge the same for a pool session that we charge for a clinic session. It's as simple as that. So clients, whatever they pay for the clinic, they'll pay for the pool. It's one-on-one physiotherapy with a qualified aquatic physiotherapy with a qualified aquatic therapist. And we're not making excuses for that. And that's what clients pay. We keep them fully supervised and fully safe, and they get a professional session in the water. So that's the fees, the access, the duration, the contraindications, a touch on the physics and physiology. We've also had a look at the water, the quality of the chemistry, that's the word I'm searching for, the temperature, a definition of hydrotherapy, and the depth. And you know, there's some beautiful pools around. The history of hydrotherapy is fantastic. Much of it originates from Greece with Hippocrates. He was the founding father of hydrotherapy, and there's a statue in his name, a monument in the Greek island of Kos. But when you go around all the countries, the Philippines has some really nice hydrotherapy pools. In India, there's an absolutely gorgeous pool at northwest India at Jodhpur. And I use a picture of that pool as my opening slide on my hydrotherapy education talks. It's a wonderful pool and environment. And there's a lot of history with hydrotherapy and water therapy in India. Throughout Europe, Japan, and the onsens, hot springs. A great history there. And China, some of the ancient pools originated there. Throughout Europe, in Belgium, there's a town called the Spa Town, and the name of the town is called Spa, and that's where the word spa comes from. You go to Germany on the fringes of the Black Forest, some beautiful pools there. In New Zealand, some great aquatic paradises there, and we run our hydro courses in 3 cities in New Zealand. And we've talked about Australia, there's some really nice pools, and England, which is my country of origin. Throughout the north of England, there's some very famous spa towns, Leamington and Harrogate, and many other great towns in the northern parts of England. So lots of good history on hydrotherapy. There's a few good textbooks on it. And I do encourage listeners and participants this afternoon, evening, to build their ammunition and resources on reading material on hydrotherapy, and attend some courses where possible. Many of my Indian colleagues have come to Australia to attend my courses, or elsewhere in Asia. Now we've got through there a good 25 minutes. I'm going to talk a little bit now on chronic conditions and how it relates to hydrotherapy, and then time for questions. And then we can unmute and take questions from the floor. Chronic conditions that we see in hydrotherapy, and you know, quite often it molds into disability as well. And some Asian countries consider some chronic conditions as disabilities. So sometimes they're each and alike. The ones that we tend to see commonly are the musculoskeletal conditions. And we see them every day of the week in the clinics. And we encourage every day of the week for those to come into the hydrotherapy setting. What do we see musculoskeletally? We see your hip and knee replacements, your ACL and PCL ruptures, your meniscal tears, your tibia and fibula fractures, your foot fractures. We're looking at any arthritic hip, arthritic knees, arthritic spines, chronic back pain, and all of the back pain syndromes, disc bulges and protrusions, stenosis. We're looking at the sacroiliac pain, piriformis syndrome, sciatica, the full range of back pathologies that you'd routinely see in a clinic. It's painful to walk on land, take them into the water. Musculoskeletally, anything else around the knee, ankle, and hip will do for rehabilitation. What are we looking at? Osgood-Schlatters disease, Sever's disease of the foot, plantar fasciitis, heel spurs, Morton's neuroma, any multi-pathology fractures around the foot. And we've got some classics in our clinic at the present time. Got a wonderful Indian lady in at the moment. She was run over by a forklift, and the foot is pretty much shrapnel. Lots of little fragments of bones floating everywhere around the foot. In a moon boot, on crutches. She'll be in the pool at the end of this week. Fantastic rehabilitation for those multi-traumas in the foot and lower limbs to get people from weight bearing as tolerated up to faster walking, work on the gait re-education, strength, balance, proprioception, and they're on their way into the gym programs. That's good there. So that's some of the musculoskeletal. Other ones in the musculoskeletal environment. We're looking at, my goodness, bamboo spine. It's called. which is, my goodness, the word's just escaping me at the present time. That will come to me. The osteoporosis we're looking at, osteopenia, perfect for the hydrotherapy setting. Spondyloarthritis. My goodness, what's the condition?
Ankylosing spondylosis.
Thank you, Gufran. My goodness, you're reading my mind. You see, Gufran isn't just a physio, he's a magician. And he can read minds.
Yeah.
Absolutely. That's the one I was searching for. And I used to run the Anki-Spond group in England. And we've got a number of Anki-Sponds here in Australia. And it's a first-line treatment for bamboo spine or ankylosing or AS. And it's a wonderful treatment for it. And it's sometimes called the equator syndrome of its commonality around the equator countries. Chronic conditions, moving on, musculoskeletal, we've talked about the arthritis, the common ones, the rheumatoid arthritis, how could I forget that? The juvenile chronic arthritis. And we get the kids in, the 15, 16, 17-year-olds. It's just the same kind of symptoms, pain in the knees and hips with the kids. We'll get them into the water just like we would with adults. Cardiovascular conditions, you're looking at hypertension, any heart failures are good for the pool. Different criteria, you wouldn't want end-stage heart failure in, but hypertension, heart failure, coronary artery disease, heart attacks once they are stable and out of the acute phase, because people do not want a second and third and fourth heart attack. So let's get them reconditioned in a friendly environment. And it's a beautiful environment to work in, out of the stuffy clinic environment that we usually see. So cardiovascular conditions are fantastic for hydrotherapy. Metabolic conditions, and especially diabetes, type 2, or indeed type 1, great environment for hydrotherapy, often called a lifestyle disease. People will be overweight, morbidly obese, trouble, under-exercised. The pool is a thick, viscous environment to really work out. So that's something to consider for the pool. For a real huff and puff session, we give the type 2 stable diabetics and also those with pre-diabetes on the fringes of it, or metabolic syndrome is the word I'm searching for there. So those are ones we routinely get into the pool as well on the metabolic. On the cancers, it's great therapy for cancers of all stages. Pre-diagnosis, we all know that physical activity reduces risk. So that's a selling point there. We'll ask clients to come in to increase their exercise levels, especially if they're shy of the gym or home programs. So physical activity in the water for prevention of certain cancers or assisting with the lowering of the risk. Once diagnosed, it's a nice environment to lift spirits when people have lost strength, balance, have pain, into the water, providing not immunocompromised, and there's no wounds and lines, they're good to go. So we often have a good range of cancer clients in the pool, prostate, breast, bowel, for rehabilitation whilst they're undergoing their course of treatment and getting tests, etc. For breast cancer, sometimes you get the associated lymphedema, and the water is a great environment for the compression on the affected limb. So we'll do a little bit of submerged arm work in the pool and some other activities for that particular population there. Mental health, we know physical activity lifts spirits. So it's a great environment, is hydrotherapy, for getting people moving and acting as a distraction therapy, really getting people focused with mental health issues, commonly depression, anxiety, schizophrenia, bipolar disorder, hearing voices, dissociative syndrome. Into the pool, and I love that extra activity and also the relaxation. So you get clients into the supine position, some really nice relaxation techniques that we can only share once we're doing a practical. And we routinely do that, showing the weaving or seaweeding options. So the chronic conditions, we've looked and touched on mental health. on metabolic, on cancers, on cardiovascular, on musculoskeletal, and we'll touch on respiratory. So some of the common respiratory conditions is the COPD or COAD, whichever term you choose. And when I was a student, it was commonly COAD, chronic obstructive airways disease, and then it moved on to PD. And I was told today it's now moving back to AD as the contemporary term for that. Regardless, it's a limitation in the respiratory function. The pool can be wonderful for those clients that need some conditioning, some strength, to really push people along with chest muscle strengthening exercise with some wall push-ups, some stretches into the pool. And remember, if they're deconditioned and they've got low VO2 max and a poor respiratory capacity, it'll only get poorer if they don't exercise. And if they can't exercise on land, it's too tough. We give them an easy option in the water with the buoyancy, and we'll keep their respiratory function at least maintained. And as I earlier mentioned, try not to venture to the deep end, so they are not struggling too much with the compression on the chest wall. So we keep it at waist level and simply execute a tailored program for the respiratory clients. Other respiratory conditions we'd see there, we've had double lung transplants into the pool, little kids in with respiratory illnesses on their oxygen tubings, bronchiectasis, anybody that needs to shift the lungs, a bit of exercise really loosens things, a bit of exercise and movement loosens the secretions. And similarly with the cerebral palsy clients that have associated respiratory issues, the pool tends to loosen those with the humidity of the pool environment. So that's some considerations for the respiratory chronic conditions. Now I've got a few more minutes, then we're going to open up to questions. They're the main common chronic conditions that we see. We also get kidney disease. That's anything from 10 to 15% incidence in Australia and throughout Southeast Asia. So it's a common chronic condition, not a contraindication for the water unless it's end-stage kidney failure. So that's a nice therapy option to manage chronic kidney disease, kidney failure. Some of the disabilities that roll into chronic disease, some of the common ones I've touched on the cerebral palsies that we see, the Down syndromes, absolutely routine bread and butter for hydrotherapy setting. We're looking at MS, multiple sclerosis, muscular dystrophy, and I touched on that a little earlier, and the family of muscular dystrophy. That's the Duchenne's that we see with the kids. Water's great for all of the stretches, especially the calf and the hip, the flexors and the hams, and also maintaining their fitness within limits to slow the progression of the condition. We're not going to reverse that. Some of the other ones that aren't as terminal as the Duchenne's is the Becker muscular dystrophy, and we've got several of them on our books, along with facioscapulohumeral. So there's some of the common dystrophies, and we also have the Mericin negative or deficient. That's probably the fourth or fifth most common as well. So the family of dystrophies respond particularly well to the hydrotherapy setting. Something to consider when you come across that population in your own environment. The deaf, the sensory impaired, my goodness, the deaf, the blind, or the deaf and blind. Fantastic environment. Do not let them miss out. If you have no vision, if you've got no hearing, you've got a dark world. You don't know who's talking to you. You don't know who's in front of you. You cannot see or hear anything. And for some, that's from day one of their lives. What can they do? You can't take them to the movies. You can't take them to the beach. You can't read them a book. You can't do anything. You can take them into the water. You'll be amazed at the sensation they feel with that new sensory input, the sense of touch. They've been stripped of the top two, hearing and vision, give them that sense of touch and the revel in it. Absolutely love it. Upgrade, double sessions, do cartwheels, crocodile rolls, and you can do all sorts. You're really opening up their world and giving quality of life to the sensory impaired population, especially the double sensory impaired population there. Cerebral palsy we have mentioned, which is a routine condition we see, but we'll also see Tourette's syndrome, autism, Asperger's. They respond fantastically in the water. And autism is an area we did research on recently, published this year. Google it when this webinar finishes, and you'll see our paper that was approved and published in January. So all you need to Google is hydrotherapy autism, and you'll see myself and my colleague's name on a paper on that and how people respond with that particular condition there. Other chronic conditions we see, how could we forget Parkinson's disease, Parkinson's syndrome, and Parkinson's plus from James Parkinson in 1888. Great environment because balance and gait are affected, and strength. What can the water do? Influence all of those areas. So get them in the pool. I mentioned osteopenia, porosis, Parkinson's, Parkinson's plus, the balance and neurological clients. And on that segue, neurological, Angelman syndrome and some of the lesser known conditions that we'd see neurologically, great for the water. Elderly care. There's no age limit to hydro, so do feel free to encourage the elderly to come along, and especially if you've got sore joints, to enjoy the water environment. Balance, strength, and mobility are the top three areas for that particular population there on the elderly care. Finally, got a couple of minutes left, then we'll go to questions. Pediatrics, and we see many kids in the pool. Juvenile chronic arthritis we've mentioned. Down syndrome. Childhood obesity. Autism, Asperger's. There's a whole raft of pediatric conditions that would benefit from the pool. And, you know, if you're used to adults and want to stay with adults, that's fine. But it limits you. If you want a little bit of a challenge, then start considering some pediatric conditions as well. And it's professional development for yourselves. And then you get more comfortable and confident with that particular population. So we get lots of kids in the pool. And sports. It's a great environment for sports injuries as well. But another day there, we're talking mainly about chronic disease tonight. So that's some of the kids' chronic conditions, the adult chronic conditions, the main ones that we tend to see. We'll see all sorts of things in the pool, all sorts of conditions, syndromes, disabilities, and unusual conditions as well, and very rare conditions, but they do fantastic in the water. So if you're new and considering doing some hydro, start off nice and steady with some relatively low-grade, easy conditions, and then just onwards and upwards, increase your portfolio. And like a pilot of a plane, the more flying hours you get, the more confident and comfortable you are. The more hours in the pool you get, same story. We're going to open up to questions.
So guys, now you can ask your questions to Michael, sir, as the topic is over, and it was great topic, sir.
Thank you.
So now you can ask your questions if someone wants to ask. If you can write them down in the chat section, it is also fine. We can read them and then we can, sir can answer it.
No questions, that's good. Maybe we've answered all of the questions.
Yes, sir, it was really great. So, sir, what about the cerebral palsy?
Yep.
Like, do you take a cerebral palsy in pediatrics?
Of course we do. That's one of the main areas we look at. Good question, good friend. Thank you for that. Absolutely. And in cerebral palsy, we'll take the mildly affected, the moderately affected, the severely affected, the profoundly affected. We'll take all levels right up to the level that have no communication, 24/7 care. And quite often their families and carers will say, look, we're not expecting you to turn up miracles here. We'd like you to give our son or our daughter some quality of life. And we've heard that you do hydrotherapy. Just like I mentioned before with the deaf and blind population, parents, carers, guardians want quality of life for those disadvantaged clients that are so profoundly disabled that they need 24/7 care. Yes, we're one of the few organizations that will take that level of client, and we're privileged to be given the responsibility of those clients, and we'll do exactly that. We look after them.
We have a question over here, sir. There is a question. After how many days can you start hydrotherapy for hip and knee replacement?
That's good. Thank you, Shakshi, for asking the first question. And for asking the first question, you get a holiday for 2 weeks in Fiji. You qualify. And Gufran's paying. A good question. I'll answer the first one. How many days afterwards? I talked earlier when the wound is healed and sealed, then they're good to go. So it's usually 2 to 3 weeks for hip and knee replacement. Another question here coming in now. Please share some thoughts about cold rubbing. In what conditions? Now, what is cold rubbing? Samia, if you can explain a little bit more on that one. I'll come back with your typing question on that. Hydrotherapy in fibromyalgia? Yes, it is. Many research papers written on that. And at any one session that we run, we've always got lots of fibromyalgia patients in the pool. It's a controlled session. Do not overcook them. So you keep the session controlled. Around 25, 30 minutes, not lots of sets and reps on the shorter side. And they love it and get lots of benefit from fibromyalgia. Cold rubbing, what's that one? I do not know. So please give me some more thought. Yeah. Come back with a bit more on this. Keep the questions coming.
So any other question, guys? Please ask and sir will answer all your questions. Sir, so there's a question here. Sir, what will be an ideal clothing for the patient and the therapist for hydrotherapy?
Yeah, good question, good friend. Thank you. The ideal clothing. Oh, that's come in there from Priyanka. Yes, sorry, you read that one. Look, many times it's cultural. So whatever you're comfortable with. And we have some Muslim therapists that will come in heavily dressed, and the Muslim clients will too. And sometimes they will not want to be seen by a male therapist, even in the environment of the pool area. So we're always conscious of cultural requirements in hydrotherapy. Our team, we wear rash tops, and I'll show you one. I'll just get one now for you.
Okay, sir. Okay.
These are the tops we wear on our team. I've got one here. This is them, the black top. We put our names on, and this is, there you can see there, this is one of our workers called Jamie. Now these are chlorine resistant tops, short sleeved. And on the back, we have a company name. So they're chlorine resistant tops, so you can wear them, they last for years as well. So they're nice tops, and on the bottom part we wear shorts. The girls and the boys, shorts and rash, it's called a rash top or a pool top. And that's the standard wear that we have. We see that commonly as well throughout Southeast Asia, that therapists will have shorts and rash top on. Clients, they say, what should I wear? I say, whatever you're comfortable in. So that could be shorts, t-shirts, swimsuits. We don't encourage bikinis. It's for the pool, but usually a t-shirt and shorts. Next question. Let's have a look. That's any more questions?
Could you please elaborate of the access methods or assistive devices used for patients that aren't ambulating.
Yes, for sure. So on the axis there, patients that can't ambulate, let's have a look. We've got many clients that cannot stand. They come into the pool environment in a wheelchair. They've been transferred into that wheelchair at their home by a hoist. They'll arrive on site at the pool, and they are then hoisted into a pool chair. And it's a plastic chair the water, and we push that chair into the water with the client in it. Sometimes we can use a sliding board, and it's a sliding board transfer from wheelchair to pool chair. So it's either hoist or sliding board. That's the two access methods for the non-ambulating client.
Any other questions, guys? So, sir, how do you counsel your patients who have phobia of water?
Great question. You know, Gufran, you're really asking some good ones tonight. It's a common phobia, a fear of water, like a fear of spiders, like a fear of flying in aeroplanes, and like a fear of injections and needles. The fear of water quite often stems from an unfortunate childhood incident when they're being pushed in water and being out of the depth. How do we do that? Yes, we do exactly what you've said. I counsel them, and I'll talk to them. I'll say, look, I understand your fears. If you can trust me, you come along to have a look. You do not have to get in. Come and see. And then once they come to the pool and have a look, they'll see that it's not a deep environment. They will see that they will be supervised one-on-one. They'll see that they can get out at any time. And I usually encourage them first time, just a few minutes in the shallow end, and then gradual, progressive from there. And we've got a number of clients now that started off exactly like that. Don't talk to me about hydro. I'm never going to go. I'm scared. Now they're regulars, come twice a week, and our biggest flag bearers. They're our marketeers. And they say how wonderful hydro is. So almost always I can negotiate and counsel clients to come. You've got to sell it to them. Explain that it's safe. It's not deep. It's warm. They'll be supervised. They do not need to swim. They're being looked after. Now on that one, let me just quickly add in, once a year, we do pool rescue training. It's hydrotherapy training, and it's what to do in the event of an emergency. We do that every year, and our staff feel comfortable and confident with that. And if you look on our Instagram, those that have tuned in, from last October, you'll see a couple of pictures from our pool rescue day. And we do it once a year. It takes about 2 hours. And we do a few maneuvers, see a client face down, how to get them out, all that kind of thing. How to manage a seizure in the pool. Any questions there? Let's have a look. Cold water therapy, is it kilo Q? Okay. All right, let's have a look. Sikender, thank you for your question there. Let me see. Kilo cure. Well, it certainly could kill somebody if it's so cold. But, you know, we don't do cold water therapy. We do hydrotherapy. So it's like, what could I say? It's off topic tonight, but I understand what you're saying. It's contrast therapy. It's hot and cold therapy. And that was done 1 or 2 centuries back. You'd go under a very cold shower and then suddenly into a very hot environment. It's like going into the sauna and out into the cold shower. It does tend to, it's called the hunting effect in electrotherapy, searching. And it really tends to stimulate the circulation. But for that, I think that sort of thing, you'd look at more of a wellness center or a spa center where you've got that extra option of cold or chilling water. So we don't do that. We just do the hydrotherapy.
There is a question from Kashmira.
Yeah. Yep, I'm just looking at that now.
Would cold water also be equivalent to cryotherapy chambers that helps post-strenuous workouts?
Well, thank you, Kashmira, for the question. Yes, it would, but it wouldn't be as cold as cryotherapy. So it would be useful. But you know, there's not a lot of clients can tolerate cold water. The sports population, it's good for, and especially recovery after DOMS, delayed onset muscle soreness, and prior to sports events. I myself used to do marathon running, and I'd often go into some freezing water on my calf muscles. It would numb them, it'd feel fantastic. Then you do really well with your particular sport. It has got a place, but not in the hydrotherapy environment. Any other questions before we sign off on tonight's wonderful webinar?
So 10 minutes are over, sir. I guess
Yep.
we have come to the end of all the questions.
Thank you for your questions. Thank you for tuning in. Thank you for listening. I hope everyone's a little more motivated and you know that we offer all of the courses, half 1 and 3 day. And you've got a great spokesperson in Gufran. Thank you, Samir, for your message.
It's a pleasure, sir. Guys, I want to tell you that Michael sir is going to come to India to have some practical courses for you all, and All About Physiotherapy will be collaborating with them. I just hope to work with him in future, and I just hope all of you are benefited with this webinar. Thanks a lot, Michael sir.
My pleasure, Gufran. Namaste.
Namaste, sir. Bye-bye. Take care. Have a good day.